Also breaking tonight, the new mask guidance from the CDC. It's reversing its indoor mask policy and now says some people who are fully vaccinated should mask up. Specifically, CDC says people in areas where the Delta variant is spreading should wear masks in public indoor spaces.
Yeah, nearly 2/3 of the counties in the U.S. are seeing high or substantial transmission. Right now, just over 62% of adults in Pennsylvania are fully vaccinated. However, the numbers hover around 40% in some other states. And that's not all. The guidance also recommends that kids from kindergarten through grade 12 wear a mask in school regardless of their vaccination status.
That's prompting a lot of school districts to pause and reconsider how they're going to handle things this fall. We have team coverage on this tonight. Nicole Ford with what local districts are saying about changes they may consider. But first, Meghan Schiller with a deeper look at this new CDC guidance and why it applies to people who are fully vaccinated. Meghan.
Ken, the CDC says even if you are fully vaccinated and somehow get a mild case of COVID, they say that you still have as much viral load in you as someone who's unvaccinated. So you wouldn't necessarily get as sick, the CDC says, but you can still spread that to people who are immunocompromised, to children who can't get the shot right now, and also to people who opt not to get vaccinated. Of the Delta variant sparking a shift Tuesday, and we found people keeping their masks close.
We're still in a pandemic. I'm still wearing my mask, so yeah.
If we don't do something soon, I mean real soon, we're going to have some major problems, major again.
The CDC saying mask up indoors in public, even if you're vaccinated. In rare occasions, some vaccinated people are getting infected with the Delta variant and spreading the virus to others. So to stop potential spread to children who can't get the shot, immunocompromised people who aren't as covered, and the unvaccinated, the CDC asks vaccinated people to mask up indoors again.
Anytime public health guidance shifts and there's misinformation and politicization, it makes it much harder to tell people what they should do or shouldn't do or who they should trust. Hopefully what we'll see is more and more people will see that the Delta variant threat is real, especially in those southern states, and start to get vaccinated.
Dr. Amesh Adalja says the threat remains low for people living in and around Pittsburgh. Take a look at this CDC map showing community spread. Yellow is moderate. He's challenging the CDC shift, arguing vaccination is the key.
And we aren't seeing cases being driven by the fully vaccinated. If you look at where cases are going up, it's in places where vaccine levels are low. That's not a coincidence.
Here in PA, we're ranked 8th in first doses administered, and nearly 78% of Pennsylvanians 18 and older already received at least one dose.
I think the important point to remember is that the vaccines are the solution. They're performing tremendously. Just walk in a hospital now and see how different it is.
This change involves indoor public settings, meaning businesses face another decision: put the mask signs back up or choose to ignore these changed recommendations. Coming up tonight at 6, I am talking with the owner of this pizza shop about how she plans to maneuver these changes with her young employees. Reporting in Ross Township tonight, Meghan Schiller, KDKA News.